Hey everyone, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name is Dr. Jared Skowron, and I've been an autism biomedical doctor for 21 years, and this podcast is to help you help your child with autism. Now, maybe you're a parent of somebody with autism, or a teacher, or a therapist, or a doctor, or a grandparent, or whatever. Either way, there is so much that we can do to help our kids with autism, and this podcast is to walk you through all of the different things that you can do. We focus and specialize on treating autism as a medical condition, which it is, and there are tens of thousands, if not hundreds of thousands, of scientific research papers published about autism that we can show you that there is science behind what we're doing to help our kids speak more, behave better, sleep better, and grow up to be independent, functional adults. That's our goal for all of our kids as parents. So, our podcast, if you're ever interested in taking part in a live recording of our podcasts, we record our podcast on our Facebook page. That's Spectrum Awakening Facebook page. Every Thursday, 12:15 p.m., I take my lunch on Thursdays and walk you guys through a topic to help your kids. Now, these first few months of 2025, I can't believe it's already mid-February, we're going to be creating a mini-series kind of walking you through an assembly line or a flow chart or a map of how I help kids with autism in my telemedicine practice. So what we started with in January, if you want to go back and listen to any of those, were podcasts about why do our kids get autism and the different causes that I see in the science and that I see clinically. That is the reason for our kids and why they have developmental delays and what causes those and how those are treated differently depending on the child. We then got into the first most important thing, and again, if you are listening to this podcast and you're new to treating autism medically, the first thing you do, okay, number one, the first thing you do, we did our podcast last week, if you want to listen to it, make sure your kids are pooping a full amount on a daily basis. That is the number one thing that you can do right now to help your child feel better and behave better, and maybe even help some of their sensory issues in toe walking, all right? So that's number one, is get them pooping completely every day. At our last podcast, we talked about some different natural ways that we can do that, because I'm no big fan of Miralax. It has psychiatric side effects, and there's so much other things that have been used for longer and are effective and safe. So that's our last week's podcast. So this week's podcast, we're going to be getting into behaviors, okay? We're going to be getting into the behaviors of our kids with autism, why they happen, and how we can help our kids and of course ourselves, because I know a lot of us are walking on eggshells. Our kids have temper tantrums. Our kids are hurting themselves. They're hurting us. They're hyper. They're bouncing off the walls. They're not sleeping, or they're sleeping in bed with us. And that doesn't work out for anybody long term. So we're talking about these behaviors. And in my telemedicine practice, what I always ask parents is, what do you want? Okay. What do we want for our kids? Right. And it's usually one of three answers or all three answers, okay? Number one, more language. I want to understand what my child's thinking, what my child's feeling. I want them to be able to learn and express things. Number two, which we'll talk about today, is behaviors, okay? And we'll get into different types of behaviors. And number three is our kids growing up and being independent, right? We're not going to be here forever as parents. We want our kids to have a good life, and that's what every parent wants. Okay, so let's get into those behaviors. Now, if I were to list the different types of behaviors I hear about, okay, you have things as simple as hyperactivity. My kid's hyper, they're bouncing off the walls, they're using my furniture as a jungle gym. Okay, hyperactivity. Then we have kids who are okay until there's transitions, okay, and transition sets them off the wall. You have to turn off the tablet, turn off the iPad, get in the car, we're going to therapy either way, and all of a sudden, now I have an explosion, okay? And then there's kids where the behaviors start to become more troublesome. And this is often when they're hurting themselves, they're hurting others, they're hurting teachers, therapists, etc. These kind of outbursts are unacceptable because people are being harmed, okay? And we don't want that. So when I go back and talk to families about these behaviors, again, like we talked about earlier last month, there's different causes of autism. There's different causes of these behaviors, okay? So let's go through some of the simple ones when we talk about hyperactivity. Number one, first and foremost, of course, we got to make sure we look at their diet. how much sugar do they have in their diet, how many snacks, how much candy do they have in their diet. That sugar is going to set anybody off. Okay. I'd also look for artificial colors, artificial dyes. Try to eliminate those. Okay. Those are only chemicals that are associated with hyperactivity and ADD. They're outlawed across the European Union. They're outlawed in other countries because, frankly, they're just chemicals with no health benefits, only marketing benefits, and they can harm our body. Okay? So start with those kind of basics right there. Let's get that sugar out for that hyperactivity. Now, that's not the only cause of hyperactivity. We have imbalances of neurotransmitters. We have low serotonin levels. We have a lot of glutamate, a lot of adrenaline, a lot of histamine in our kids, which kind of ramps them up as well. We'll get into that next week as we talk about neurotransmitters and such. But let's focus more right now on the anger, the defiance, the violence, the self-harm, the self-injurious behaviors, whatever words you want to call them, okay? Your child is having an outburst. So a lot of times we just want to calm those outbursts down, all right? Those outbursts are troublesome for us, troublesome for school. We don't want to get those calls from teachers, and they're troublesome for the kids. They don't feel good when they're hurting themselves, and they don't want to hurt us. So a lot of times conventional medicine is just, let me shut up the symptom, okay? Hey, you've got a fever and you hurt. Here's some ibuprofen. You don't have any fever and hurt anymore, okay? I don't know if that's beneficial for you health-wise, but you feel better, problem solved, moving on, okay? So conventional medicine likes to do this a lot, even with our kids, with psych meds. So a lot of even my patients will talk to me, say, hey, I want to get off my clonidine. I want to get off my Lexapro. I want to get off my ADD stimulants because they're making my child more hyper, right? I want to get off the risperidone. It's turning my kid into a zombie. So, conventional docs throw psych meds at this kind of stuff because that's what they're used to. They're used to saying, hey, somebody's upset. They must be sad. And let's give them medications to stop the sad or to numb the sad so they're not reacting anymore, okay? This rarely works. It rarely works for practically all my patients because this imbalance of neurotransmitters is not where the behavior's coming from. I got to pause real quick. Live shout out to Alexandra. She is a great mom out in Romania. She does, I think, halftime Romania and UK, but a great mom out there in Europe spreading the word for helping kids. So live shout out, Alexandra. Haven't seen you in a while. So when we get to these angry behaviors, it's the conventional way of psych meds, let me numb your sadness, doesn't work. Okay. So what does work? And therefore and deeper than that, what's causing the problem? All right. I want you to think about this. And I say it a lot. So if you've heard it before, you'll hear it again. But if you're new, I want you to listen to this. Put yourself in your child's shoes. Okay. What do you, block out the screaming and the all that stress that's putting you into overdrive and putting you into fight or flight. Okay. Put yourself in their shoes. What is going on? Okay. Why do we as adults have outbursts? Well, it's normally either because maybe I am sad, maybe I'm depressed, maybe I'm scared, maybe I'm anxious, right? Or maybe I'm in pain. And that pain will set all of us up, for not feeling well. So when a child is nonverbal, when a child doesn't have all the conversational skills they need, when they're in pain, they have no other way to tell you except to show you. All right? I am in pain. Let me act out my pain. Let me bang my head. Let me scratch myself. Let me pull my hair out. Let me pull your hair out. Let me scratch you. These are nonverbal ways that your child is saying, help me. I'm crying. I'm screaming because of pain. All right? I want you to go down that road or go into the road of your child, the mind of your child, and what is causing their reaction? Is it fear of transitions? Okay? A transitional temper tantrums are usually fear-induced. I don't know what I'm safe here. Where am I going now? What is that? It seems unsafe to me. I was talking to a patient just this week about their child with a lot of anxiety, and the mom will pick up all of her 3 kids after school in a row, pick up her child with autism first, pick up kid number 2, kid number 3. Kid number 1 gets in the car, child with anxiety and autism, and says, let's go home. We got to go home. We got to go home. We got to go home. Home, because they don't feel safe. They want to be safe. And every day they pick up child number 2, child number 3, but the anxiety goes on. They're like, where are we going? What are we doing? Like, we're getting your brother, we're getting your sister, but the anxiety is still there. So again, put yourself in their shoes so we can figure out why they're feeling this way and therefore why they're acting this way. All right. So all that moving forward, okay? The majority of pain in our kids, okay? Let's get back to the pain, the driver for a lot of these behaviors for our kids. The pain, you need to identify location and you need to help them through it, okay? Common causes of pain in our kids, teething, which can happen at so many different ages of life. I mean, even my 12-year-old is still pushing some of her incisors, okay? Teething pain. Number 2, we have growing pains. All right. So if they're holding their leg, if they're holding their arm, it's usually near the joint, near the elbow, near the knee, near the hip. That could be growing pains. All right. But also very intermittent with that kind of behavior. Number 3 and most common is going to be infections. Right. And the most common part or the most common place for infections in our kids is in the gut. All right. The immune system in our kids' guts is poor. It's poor. Okay. Reasoning behind that, I do feel it has to do with mitochondrial dysfunction, which affects immune system. Either way, our kids are predisposed to gut infections, period. Those could be bacterial, those could be viral, those could be fungal, those could be yeast, those could be mold, those could be parasites, worms, you name it. Our kids get it. I test for it in my patients. I've seen it. I've seen it all, okay? So those infections hurt, right? We've all had stomach bugs. It's not fun. It's pain. It's pain that we can handle. But then you take a child with a poor immune system, a gut bug of whatever form, and sensory issues. And now that pain that they normally feel as irritating with things like tags in the shirt, haircuts, nail clippings, that pain in their gut is just turned up so high. And they don't know what to do with it. They don't know what to do with that pain. Okay? So working on gut infections is the number one thing after treating constipation that you can do to help your kids' behaviors. All right. How do we do this? How do we test for it? And where's the science? So let's get into it. Okay. Number 1, if you want to know if your child has a gut infection, okay, get a stool test. All right. What's a stool test? It's a test of your poop to look for infections, to look for digestion, to look for inflammation. It's a great way to see what's going on inside the gut because frankly, the only other way we have is to stick a camera. Stick a camera down here, I can stick a camera up there. So the stool testing is really how we do this. Now, you're going to want a good stool test, okay? Your doctor has to know what they're ordering because you want full analysis of bacteria. You want full analysis of yeast, and you want full analysis of parasites, okay? So you want to make sure you get this testing done right. This can be done with conventional labs. I will do it personally in my clinic for my patients with LabCorp. They have a decent test, right? Or you can use these other independent labs that are very specialized and have excellent stool testing. So you got to pay for those most of the time, but those are your options. Now we have these very comprehensive stool tests on our website, Spectrum Awakening. So if you ever want to get one, you can go to our website, order the stool test. It'll come to your house. You follow the instructions, collect the poop, send it off to the lab. We'll get the results. We'll send you the results and I'll write up a written interpretation of what's in there. What does it mean and what should I do? Okay. So stool testing's the way to go. That being said, stool tests for parasites are often very inaccurate. All right. And I'm glad I'm bringing this up now because either yesterday or the day before was a full moon, right? Now, why am I mentioning full moons and parasites? Well, we've all seen movies. We've all seen television shows where it's usually Halloween night and it's a full moon and the emergency room in the medical show or medical movie is swarmed with people having mental breakdowns. They're swarmed with psychiatric cases and people having hallucinations and going insane, right? And it's true. I mean, anybody who works in the medical field, works in an ER, an ED, knows full moon is going to bring out those people, okay? And it is because parasites have this routine, a cycle. I'm going to use the word cycle. It's a better word. This cycle where they're not always causing trouble, okay? They actually live within your cells. That's why it's hard to test in a stool test. They're not in the poop. They're hiding in the cell. So the full moon or the new moon is when they seem to hatch, they seem to make babies, and they seem to cause trouble. So If any of your kids this week are having a lot of bad behaviors, all right, full moon, think parasites. And now's the time to test. The time to test to get the most accurate result is this full moon time, or when your child is having these outbursts and these behaviors, okay? Because if you screen for parasites and they're not active, it may come back normal on the test. Extremely, extremely common for parasites to come back normal on the testing because they're in the cells. They're not out causing trouble. Okay? So that's the testing. If you want to know, you want to test, get a stool test. All right? Through your doctor, through our website, either way. Now, what do you do when you finally find them? Okay? 2 things are going to be most important. Okay? Number 1, you obviously want to kill these guys. Right? You got an infection, you want to kill it. Okay. You want to throw the book at this thing. All right. If you want to use natural things, use natural things. We'll go through them, right? If you want to use pharmaceuticals, use pharmaceuticals. You want to use both, use both. You've got to go after this stuff because it can be tricky to get rid of, right? I'm watching some comments go by already talking about, hey, we've been treating yeast for a while. We still need more help. It's not working. What do we do? Okay. It's a struggle. Treating these gut infections are a struggle because while our treatments are effective, we've got to make sure we get your child's immune system kicking in because once the treatment's done, then that stuff's just going to grow back again, right? So it's throw the book at this when it comes to things to kill it. Now, here's the extra thing that you need to do. Remember I said 2 things. Number 1, kill it. We'll talk about natural things. Number 2, you've got to get those out. All right? We've killed bugs. Let's get them out. Because as they're dying, they're going to decompose and they're going to let all their insides, within the cells, going to spill out. And those chemicals that are inside can cause more pain, more inflammation, more trouble. So we will see with our kids that when you're doing gut treatments, it may seem like you're getting worse first. It may seem like the behaviors are getting worse. The sleep is getting worse. All right? Because we're actually, causing more pain by killing the bugs. So if you've ever done nystat, diflucan, antibiotics, probiotics, prebiotics, inulin, whatever, any gut treatment that seemed to make the child worse was actually effective. But we got to get these bugs out. That's why last week we started our podcast with constipation. You got to be pooping. You got to be moving this stuff out every day, all of it. All right. Number 2, you've got to have a binder. Okay. Let me say that again. Number 2, in our treatment to get rid of these infections, you need a binder. What is a binder? A binder is like, the water filtration cartridge in a water filtration system. Okay. Let's take something simple like a Brita pitcher or just a water filter pitcher, right? You put these filter cartridges in there, right? And you look at them, they kind of look like charcoal because they are, right? What does that filter do? It binds, it grabs all the bad stuff from your faucet into the pitcher, goes through that binder, goes through that filter, and you've got cleaner water with the impurities removed. That's a binder, all right? We've got to do this with the infections we're killing. So make sure your child's taking a binder. There's a lot of binders out there. There's charcoal, there's bentonite clay, there's chlorella, there's silica, there's a lot, all right? We've got a couple gut binders that we formulated. We had one, our yeast mold binder, which was mostly chlorella, great binder. Didn't taste great. We now have a newer one, which we took on last year, which is called Gut Binder Sweet Tasting, more comprehensive formula and a better flavor for your kids who can't swallow pills. All right. If you're doing, and again, if you need to remember one thing from today, here's the one thing. If your child is having behavior problems when you're doing gut treatments, add more binders, more times a day. More pills, okay? Just use more. All right. So what do we do naturally to kill these guys? I'm a huge fan of colloidal silver, and I like colloidal silver because it's practically tasteless and a lot of great science, which we're going to talk about today. There's also a lot of great herbs out there. I'm a fan of grapefruit seed extract. We have other supplements like Biocillin and Paraslayer and No More Mr. Nice Guy, which is essential oils of like oregano, and I think fennel and ginger, something like that. But there's so many great herbal treatments to kill these bugs, right? And again, pharmaceuticals as well. So whatever you want to go for it. The good thing about the natural stuff is that they're very broad spectrum. So if you take an antibiotic, you'll kill bacteria. You won't kill yeast, right? If you take an antifungal like nystatin or diflucan or ketoconazole, you'll kill the yeast, you won't kill the bacteria or the parasites. So the natural stuff is much more broad spectrum, and we'll get into the science behind that. But kind of recapping, then we'll get to our scientific research. The behaviors in your child, okay, can be a problem. Be a problem at home, be a problem at school. We need to get into the mind of your child. We need to get into the feelings of your child. Why are you having these feelings? Okay? Why would I have those feelings? Why would I go up to a parent and rip and pull their hair out or scratch them? Okay? Or hurt myself or jump and bounce all over the place. Okay? Why would I do those things? Is it because I'm just very active and hyper inside? Is it because I have to poop and it won't go out and I'm trying to shake it out? Or is it because I'm in pain? And then you find the pain. Again, common places, teething, growing pains, gut infections are number one. So go after that gut infection. You can just give the treatments, right? There's patients of mine don't want testing, don't have testing. I have international patients in every continent around. So sometimes we don't do testing. We just treat it. All right. Binders and things to kill the bug, whether natural or pharmaceutical or both. That is going to bring you out of the behaviors 90% of the time. Okay? So let's get into the science behind it. And then we'll ask some live questions, answer some live questions. All right. Now, again, my apologies. We're doing this different for the past month because of the changes in Facebook, but I will try to get this research so you can read it. All right. Is Candida albicans a risk factor for autism? Well, the odds of the presence of Candida in kids with autism has an odds ratio of 7.21. That's huge. Much higher in those in autism. And Candida, therefore, may be an etiological factor for autistic behaviors in children. And this is really why I wanted to focus on this study, is because the gut infections, and Candida is a common one, not everybody, but it's common, is a cause of behaviors. Why? Pain. Period. Okay? So, and this just shows the huge amount of Candida in our kids versus neurotypicals. All right, here's another one. Could Candida be involved in the pathophysiology of autism? Well, the modulation of our microbiotic composition in the gut may decrease Candida and help reduce GI problems and autism symptoms. Again, getting rid of the Candida helps with the autism symptoms. All right, here's the last one on Candida. Anti-Candida albicans IgG antibodies in children with autism. Well, Candida antibodies were found in 36% of kids with autism and only 14% of neurotypical controls. So GI dysfunction was found in half of those kids who were positive for Candida antibodies. Now, what's a Candida antibody? There's two ways you can test for an infection, any kind of infection, right? Number one is finding it. I do a poop test. I find Candida in it. I see it. It's there. All right? I test the blood. I see strep. It's there. Or I swab my throat. I see strep. It's there. I physically can identify with lab testing an actual infection. The other way we look for these things is with antibodies. Okay? If your body was exposed to an infection, it's going to have an immune response. So we can look for the immune response and then make an assumption. Is the infection still there? Or, hey, I've come up to this infection in the past, all right? We do this kind of testing for vaccine efficacy. Say, we can test your body to see if it responded to a vaccine, if it did not respond to a vaccine, or if it over-responded to a vaccine. And this is by looking at the immune system antibodies. So that's what that means. All right, let's slide over from Candida to parasites. All right, so relationship between toxoplasmosis and autism. Now, toxoplasmosis is a foodborne parasite that's investigated in many psychiatric diseases, such as autism. The odds ratio of having a toxoplasma infection was 1.93, decently high, and toxoplasmosis plays an important role as a risk factor for autism. All right, where there's parasites. Let me just stop here and take a break. This is the only research study that I printed out for today about parasites. There's not a lot of them, but trust me, parasites are well known to cause psychiatric conditions, psychiatric diseases. Even the first line of this abstract in the science study, a foodborne parasite is investigated in many psychiatric diseases. We in science know. We in psychiatry know, all right? Parasites and worms can cause mental changes. can cause hallucinations. So this is the connection of why these can change our behaviors in our kids. Who knows what they're thinking? Who knows what they're feeling? Who knows what they're seeing? All right? So let's talk about getting rid of them. And again, as I mentioned, getting rid of them is a combination of binders and antimicrobials. I pulled up research on colloidal silver because, number one, it's one of my favorites. We've got a great colloidal silver product on our website, and it's got so much research. So let's get into the research on colloidal silver. One quick note, in scientific research, colloidal silver is known as silver nanoparticles. So when you're reading research, silver nanoparticles or silver gold gold nanoparticles is colloidal silver, colloidal gold. That's how it's called. I'm interested in colloidal gold. That's kind of the next thing on the list, which is interesting. All right. So here's a role of silver nanoparticles in antimicrobial mechanisms. Antimicrobial silver nanoparticles demonstrate efficacy to gram-positive bacteria, gram-negative bacteria, fungi, viruses, and parasites. That's right, colloidal silver can kill them all right? Here's antifungal and anti-mycotoxin efficacy of silver nanoparticles. That's right. The silver nanoparticles, that's right there, the abbreviation, showed notable antifungal activity and potency in thwarting mycotoxin production. Hold on a minute. Let's turn around. What's a mycotoxin? A mycotoxin is a toxic substance excreted by mold. So this is a great example of how antimicrobial gut treatments can cause more symptoms. Because if there's a mold organism and it has toxins inside, mycotoxins, mold toxins inside, when those are released, they cause problems. They're toxins, right? When that substance is killed, it breaks apart and those toxins are released all at once. And that's why these behaviors go up. We've got to bind this stuff on its way out. Okay, but the fact that colloidal silver can reduce the toxicity of mycotoxins and kill the mold, it's pretty darn cool. All right, let's continue. I got a few more here. Oh, yeah, that's a good one. I like this one. This is the influence of silver nanoparticles on the toxicity of molds. All right. Silver nanoparticles decrease the mycotoxin production from Aspergillus, that's one of the most common molds, by 81 to 96%, and reduce mold cytotoxicity by 50 to 75%, decreasing their concentration and decreasing the production of the organic acids, oxalic acid, and citric acid. So kind of a cool side note here to unpack. Number one, silver nanoparticles reduce mycotoxin production and reduce the toxicity of them. Pretty cool stuff. But they also reduce the organic acid concentration of oxalic acid and citric acid. This is why we order organic acid tests, because it's hard to find these things. So an organic acid test, if you have that oxalic acid high or those other markers in the oxalate category, it's indicative of a gut infection, because these organisms produce those substances. They get absorbed in our body, get into our urine, and we pee them out. But that's where we're putting all these things together, okay? Putting all these different markers you're finding for your kids together again. All right, what do we got here? Hey, one more. One more, we'll get to the live questions. All right, last but not least, application of silver nanoparticles in parasite treatment. Well, silver nanoparticles have strong abilities to kill multi-drug resistant bacteria, making them a potential candidate as an antibacterial drug. Silver nanoparticles have exhibited outstanding antiparasitic effects with a shorter duration of use and the enhanced ability to inhibit parasite multiplication compared to traditional antiparasitic drugs. Okay? This research study just said colloidal silver works better than antiparasitic drugs like metronidazole, albendazole, etc. Okay? Pretty interesting thing. I wouldn't throw the baby out with the bathwater. All right? I would do it all. If you can get antiparasite medication for a parasite, use it. If you can get colloidal silver, use it. If you can get other herbs in there, use them. All right? You've got to go big and hard with this stuff. That didn't come out right. Now, didn't. You need to be aggressive when you're treating this kind of stuff. So, don't have no filter anymore now, do I? All right. So, I think you kind of get the idea. I think we've kind of reviewed the whole roundabout. So let's just do it one more time. We'll get to the live questions. Behaviors are a huge struggle for many families who have kids with autism, whether the behaviors are at home, whether they're at school. Some kids know enough to behave at school and they feel safe at home, so they let it all out at home, right? My daughter does that. I go to the parent-teacher conference and they're like, she's an angel. I'm like, who are you talking about? You got the right kid there you're looking at? So behaviors are a big problem. It's one of the 3 things that my parents in my telemedicine practice ask for: better behaviors, better speech, and independence in the future. So what are those behaviors? They can be hyperactivity, they can be aggression, they can be defiance. So where do those come from? The majority of the time, and as I mentioned a couple times, but I want to say it again, put yourself in the shoes of your child. Why are they reacting that way? Why would you react that way without words? Why would you jump on your couch? Why would you pull your hair out? Why would you scratch yourself till you bleed? Okay? Think pain. Think teeth, think growing pains. Definitely think gut infection. It's the #1 cause of behaviors in our kids. And if you want to find them, you can do a stool test. Through your doc, get one on our website, either way. You don't have to do a stool test because these things are so common. We saw research on how much more common they are in our kids with autism. So treat it, right? Treat it with something natural like colloidal silver, which we have, like grapefruit seed extract, and make sure you use a binder. And again, if gut treatments cause more problems with your kids, add more binders, add more binders, add more binders. I find the stronger the reaction behaviorally to these treatments either indicate the amount of constipation your child has or the severity of the infection. So try it out. Okay. We also have something called the yeast mold bundle, which includes the colloidal silver, includes the gut binder, and an enzyme that dissolves biofilm. We didn't talk biofilm today, but biofilm is a protective layer that these organisms produce to hide themselves from the host. So they aren't killed off as easily. I mean, these things are alive and they want to defend themselves. So our yeast mold bundle also has this biofilm enzyme, which isn't necessary, but it works. All right, let's get to our live questions of the day. Fish special of the day. Why am I quoting Summer Rental? All right, live shout out from, you don't look too much like Schumer if I do that. We'll stick it up here. Live shout out to Rodney. Rodney's always watching. And Jeannie, she's always on. Vanessa, happy to finally watch live. Thanks, Vanessa. Glad you're here. Audrey, good afternoon. Shout out to her. Live shout out to Diane. Colleen. Diane, are you familiar with the TTR gene? I am not. I'm not familiar with the TTR gene, Diane. But I'll say this: if your child has it, a mutation in it, we should investigate it. There are 20,000 genes. I don't know them all, but we'll email our office, email our customer service, and let me poke around it. Sandra, my son has autism and ADHD and has had great progress on your supplements. I bought folic acid 2 times, but it keeps clumping up. Any suggestions? Yes, we had a lot production that clumped together. And it was a production issue. I won't get into the details. It was fine. It was effective. It just clumped, right? So contact our office about that and take a picture of the lot number and send it to us, and we can work it out. Yay! How much magnesium for an 8-year-old girl? So it's all individual dependent. It all depends on how constipated one person is versus another. So what I'll say is start with about 200 milligrams. And then when you are treating constipation with magnesium, which has been used since the 1600s, give a dose and the next day, watch for the result. Okay, it's not going to work instantly. It's going to take a day to get on through there. Give a dose, watch the next day. If they're still constipated, add a little more, maybe another 100 or 200 milligrams. Okay, still constipated, add more. Oops, we have diarrhea. Next day, reduce the dose. So it's very individual. Colleen, live shout out. Lee, good morning. All right, Lee, Lee is patient, and we've been working on a couple of our patients from around the holidays, and Lee I passed that message through the chain to our team, but you're still waiting. So that message was not heard up the chain now, was it? Or down the chain, either way. Let me look into that, Lee. Georgette, Hey, Doc, hope you're well. We purchased your Pear Slayer and your yeast mold bundle. She's in South Africa. We do have a distributor in South Africa. Make sure you're aware of them. Forget their name right off the top of my head. But you can just Google Spectrum Awakening in South Africa. Anyway, can we use everything at the same time with the yeast mold bundle and the Pear Slayer? Yes. I noticed the binder said you may have exposure to lead. Can you explain this? Sure. There are certain supplements in the U.S. where certain ingredients have a risk of toxicity. Every single product we make, we put through quality control and testing for these things. So we make sure anything that we produce does not have heavy metals, okay? Based on all the FDA regulations, we want to make sure our stuff is safe. However, there are certain places in the U.S. where if you use those substances, even if you've screened them and they're free of lead and other stuff, you still have to put a warning label, all right? So that's why some of our products and any supplements made here in the U.S. or sold here in the U.S. to certain places have to have certain warnings. But rest assured, we can always, dig up these assays, if you're interested and say, hey, look, this is the lot number. We screened it. We tested it. Our stuff we want it safe. Trust me. Can you advise on the way forward to starting these two protocols together? I would just take one of every of those bottles, 4 bottles in the morning, take them together. In the evening, take them together. Take it all at once. All right. Gada, can autistic child marry in the future? I hope so. I want that. I've had kids who, I talk about a lot of my kids and my patients a lot. And there's one of my favorite ones to talk about, these 2 twin boys, identical twins with autism. And I started working with them 10 years ago. And now they were nonverbal, behavior problems, special ed, level 2 kind of autism kids. And now they're 16. They're juniors in high school. They are going to prom. They have dates. They're in mainstream schools. They're doing well academically. They're in cross country. They're winning, they're breaking high school records in cross country. Did I say driver's license? They are going to be independent. Okay. I hope they go off and have relationships and kids and enjoy their life. And they will. So yes, I do think it's possible. Diane, how do I balance neurotransmitters? We'll be going over that next week in our podcast in depth. But dopamine can't convert to norepinephrine. It causes him not to learn. I gave him a SAMe supplement, but is that forever? Possibly, Diane. It really depends on a few things. Number one, some of the nutritional cofactors for the dopamine to norepinephrine conversion are vitamin C and iron. So you want to make sure you're getting some of those. And we put those in with our dopamine supplement. Attention on the Double, which is our dopamine supplement. We include the iron and vitamin C in that powder. Just enough. And the other thing is you just may have, the genetics where you can't convert dopamine to norepinephrine. If that's the case, you can try our anger management supplement. That may help. Or you just may need to go down the road of pharmaceuticals that are norepinephrine antagonists. There's certain classes of ADD meds. So SAMe can help sometimes, but those are your options. Live shout out to Alexandra. Alexandra says you need to go live on TikTok at the same time. Alexandra, I tell you, I think Alexandra, again, one of our great European moms, helps a lot of kids and families out there, says, hey, we got to do this on TikTok as well. The social media winds are blowing and Facebook is being pushed toward Instagram. Here in the US, who knows what will happen to TikTok. But we may eventually be converting to Instagram Live. That's the way Meta is moving things. They're making Facebook a lot harder. Obviously, we've been doing this on Facebook for 6 years, but it's something we're going to transition to. So just make sure all of you are following us on Instagram Spectrum Awakening. We're going to be leading things over there. And I do different little Instagram reels and research recording things on there. So make sure you're on both. Goddess is a very great session. Thank you. You're welcome. Armando. Hey, Doc. Hope Enzo's doing well. My Enzo's geneticist ordered his whole exome sequence and everything came back the same. She then recommended a whole genome sequence. We're still waiting on the results, but I was wondering if there's an experience, if there's a chance of finding something new in this test. Okay. Good question, Armando. Armando's asking the difference between genetic tests. There's a whole exome and a whole genome, all right? A whole exome is huge. It's great. It's amazing. It's what we offer, through Spectrum Awakening. Whole genome is about 5 to 10% more. Okay, so the whole exome is pretty darn expansive, right? It's not technically everything, but it's a lot, okay? And way more than any of these genetic tests you can buy on the internet, MTHFR and stuff. We're looking at over 18,000 genes with an exome. The genome, again, just that 5 to 10% more. Will you find something? I don't know. I've never seen anything on a whole genome that came back that the whole exome didn't pick up. But again, I haven't seen a lot of them, maybe 10, maybe 20, out of 1,000 whole exomes. So do it. If insurance is paying, do it. Send me the results. I want to see a copy, right? Will it be different? Likelihood is low, but there's a chance. So you're saying there's a chance. All right. Diane, my son is scared of almost everything. Yeah, I'll tell you. And I talked to a couple patients about this week or yesterday. Man, anxiety in our kids. I should do a whole podcast on anxiety. It's so much in our kids, right? Diane, if you haven't tried our Temper Tamer supplements, maybe Temper Tamer, maybe Temper Tamer 2. They're both herbals. They're a little bit different. Try Temper Tamers 2, see if that helps. But the anxiety is so revved up in our kids. Jesse, I joined late, so I apologize if you address this. If parasites are a big issue, is this an indicator that you have heavy metals? Good question. I'm glad you brought that up. We treated parasites for 6 to 8 months. My daughter has PAN symptoms. She learned to write. She learned to color in lines and draw. I thought the metals were out. Speech hasn't gone past 3 to 4 word phrases. Yes. Gut infections like parasites may be a sign of heavy metal toxicity because the heavy metal toxicity damages mitochondrial function, which provides energy for immune system function. So that's why toxicity can kind of domino down this road. So I would, if you want to keep detoxing, keep detoxing. We just launched our new product. We talked about 2 weeks ago, Detox Dynamite, a great binder with zeolite and silica and fulvic acid and humic acid, modified citrus pectin, and what was the other thing? Lots of molybdenum, which helps with sulfur detox and metabolism. So you try that. We also just put up on our website, we haven't talked about it yet, our new detox bundle. So if you want to get a bunch of stuff together at a more affordable price, our detox bundle has our new Detox Dynamite, alpha-lipoic acid, glutathione cream, and our mineral replacement. We'll have a whole podcast on that later, but maybe you need more detox. Vanessa, I'm struggling hard with yeast. He throws me off. These aggressions, we see sensory-based, he's laughing, aggressive behaviors. We've done the standard things like nystatin, fluconazole, grapefruit extract, and herbs, but he can't get a handle. I worry about using binder because I don't want to mop up his seizure meds. Good point. I want you to use the binders at least 4 hours away from seizure meds. Okay? Seizure meds should have been absorbed by now. Whoa, hey doc, do I have to give brown log every day continuously? Does it heal the bowel and help the poo come out naturally at some point? So, good question. Short answer is, will it help the body just naturally poop on its own? No. Nope. It is a natural Band-Aid, okay? Frankly, the two things that control poop consistency the most are your foods. Do you eat foods with a lot of water, like lettuce or fruit, okay? It's not the water you drink. We actually had a research study about that in January. It's not the amount of water you drink, it's the amount of foods with water that you consume. Like, hey, pineapple, that's a lot of water, watermelon, that kind of thing, okay? Also, what foods constipate, which we talked about this last week. Bananas and dairy constipate. The more you eat of that, the more constipated you'll be. The more prunes and pears you eat, the more loose your stool will be. So, frankly, stool consistency is going to be based on what's coming through food-wise and the strength of the muscles. Our intestines are muscles, okay? They push that poop through. It just doesn't magically saunter its way down Abbey Road. So you've got to make sure those muscles are working, right? And a lot of our kids have hypotonia and poor muscle tone, not just of the skeletal muscles, but those muscles as well. So we maybe have to kick that back into function to get permanent change. All right, Denissa says hi. Hello. Bogu, can we give the brown log when giving yeast mold bundle? Heck yeah, go for it. Carolyn's on. She's on a lot. SG, my son's 13, nonverbal, developmental delayed, severely autistic. I just popped the brown log, training folic acid. currently is on risperidone. Do I need to stop that med before taking your supplements? No. And I wouldn't stop the risperidone without discussing it with your provider that prescribed it. However, if the risperidone is controlling aggressive behaviors, treat the aggressive behaviors. Don't numb the symptom. Okay, risperidone just zombies you out. Okay, a little zombie, a lot of zombie. You're sitting in the corner like Blair Witch Project. Oh, that'll date me reference. Don't just stop the risperidone. But again, if the risperidone is working, you have to ask yourself what's causing it. Not a risperidone deficiency, right? So go down that train of figuring out why there is aggression. But keep taking it, and you can take it with those supplements. Sana, hey doc, can ViroClear cause diarrhea? My 5-year-old has diarrhea ever since you started taking it. We recently increased the dose of Power and Focus. Could it be those? Well, it might be the Power and Focus because there's a little magnesium in it. So if you increase that by 50%, it could be that. Could it be the vitamin A killing off some viruses and you're seeing a die-off reaction? It might be. Hard to tell when we change two things at once. Oh, you know what I forgot, guys? I forgot the coupon. Hey, coupon of the weekend. I gotta show that the damn way. Coupon of the weekend, then we'll keep going on questions. Coupon of the weekend, Candida 20. Get you 20% off any of our supplements, any of our lab tests, like our stool test. Expires February 16th, 2025. If you want one-on-one help, you can schedule a video telemedicine appointment with me. Just go to our website, spectrumawakening.com, click appointments. You're good. All right, back to the live questions. Tashina, live shout out. Amanda, will ivermectin kill these bugs? Ivermectin will kill some of these. Yes, not all. You know, and again, pharmaceuticals are very specific on what infections and organisms they'll kill. So ivermectin's great at killing a lot of things, but it won't kill everything. So that's why I say as much as you can. Joanna, you can take Biosil and Paraslayer and Viragon at the same time? Yup. Yes, you can. What a great combo to knock off some bugs. Medina, hey doc, what supplements would you recommend for a COMT mutation and an MAOA gene mutation? I can't give anger management because my daughter tested high in glycine, which anger management has. All right, Medina, good point. So I would give the anger management, okay? You're obviously worried about too much glycine, but high glycine is part of this issue with the COMT and the MAO. Because glycine, and let me explain to everybody, there's two genes, COMT and MAO, that help remove brain chemicals. Every day we eat food and we produce them, because you are what you eat, every chemical in your body. We eat food, we produce them, and then the body gets rid of them. Make it, get rid of it, make it, get rid of it, all day long, okay? So, job security, right? The MAOA and the COMT gene help remove them. If you have slow removal process, like the Medina's child has, or she has, you're going to be building up those brain chemicals. One of them being adrenaline, okay? So a lot of adrenaline is really going to exacerbate these behaviors due to the genetics, right? So I formulated anger management to help metabolize and reduce those things. Now, glycine is a protein that also goes in to that pathway of neurotransmitter production. In fact, glycine is a neurotransmitter on its own. So what I think you're seeing is just this stopped up assembly line, right? The toilet's clogged and glycine feeds into that toilet. So I understand you don't want to give more when you have a high level, but I'm not aware of any toxicity of high glycine, okay? So I would still use it and see if it works, okay? And you may even see your glycine levels lower because now that we've cleared that toilet and cleared that assembly line, the glycine can move through it, okay? Dolly, is it best to rotate antifungals? I would. Why not? Santa, what could be the reason for increased mouthing? No dental issue, no pain, no swelling. What did I just read? Kids who mouth a lot, sensory, obviously, you're chewing on your shirt, chewing on whatever, and that's a sensory issue. If it's increasing more, is it sensory from teething? Hey, a tooth is coming through and I want to put something in my mouth to stop the pain. Very probable, okay? I also saw a research study on it that it indicated worse mitochondrial function because, your GI system goes down. Mouth, esophagus, stomach, intestines, toilet, right? Energy needs to be energy needs to be had for that to happen, move those muscles, right? When the energy isn't there because of mitochondrial function, it's like it backs up. And so we get these mouth issues of drooling and acid reflux and sometimes mouthing. So I would go down those roads, Sana. Got it. Why does this autistic child infection transmit to the brain while normal personal infection in the gut, only in the gut, never transmitted to the brain? Good question, Gata. That's because of an open blood-brain barrier. Okay, blood-brain barrier is the barrier between the brain and the rest of the body, okay, via the bloodstream. Very tight wall, okay? You don't want infections, toxins getting through there. Body knows that. When the blood-brain barrier opens up and becomes more porous, that's where these things can come in, okay? So there's also a tube, a direct pipe from the gut to the brain, okay? Follows the vagus nerve. There's a tube where things can move, right? You need an immune system that's working to stop that. So I think it's those two things, got it. All right, Denissa. Hey, Denissa. I used the yeast mold bundle with David. He did great, but I feel the Candida grew it again. I did the treatment for 3 months. How can I avoid the Candida again? Do the bundle again, Denissa. Do another few months. It's tough to get rid of. But maybe we need to add on some mitochondrial support like our Mitomax to get that immune system energized. You can also try fiber, like our prebiotic. That can help the immune system of the gut as well. Kama, what's the dosage for the colloidal silver? It depends on the brand. Ours is a half teaspoon twice a day. And also, let me say this. There's a lot of concern out there about colloidal silver, and I get it, right? Because some supplements, you're going to get similar quality no matter where you get it, no matter what brand. Things like individual vitamins, like vitamin C, vitamin D, they're all pretty similar. You know, you get a fancy brand, you get Costco. Frankly, things like that are going to be similar. When you get to other supplements, you really want the good stuff. Fish oil, omegas, you really want the good stuff. Okay, they can be laden with heavy metals. Things like CoQ10, you want the good stuff, right? Because the bad stuff is much cheaper, like 80% cheaper. So people are like, hey, I can get this cheap, right? Doesn't work. The other one's colloidal silver, because you hear these stories, hey, colloidal silver turned me blue, and colloidal silver has these potential side effects. And yeah, when it's cheap, all right? So you want to make sure that your colloidal silver is high quality. We produce a high quality colloidal silver because I want this stuff to work for you guys. But with colloidal silver, follow the dose on the bottle, but brand matters with this stuff, okay? Got it. Why is autistic child more liable for parasites and fungal infections than others? Again, it's an immune system deficiency, I believe caused by mitochondrial dysfunction, caused by toxicity. Diane, I'm giving my son mitochondrial supplements you suggested for dyspraxia. My son's writing's coming back, but his articulation is still slow and low tone. Anything I can add? Wow, Diane, guys, listen to this. This is what it's all about, okay? Child has dyspraxia, okay? Difficulty forming the words. The words are coming from the brain here, but it's difficult to get the mouth moving, right? So there's these two different medical components of language. There's the brain, you know, understanding what words mean and forming things, turning emotions into words and sending those signals down to the mouth. Then the mouth and the tongue have to move, right? So kids who have really bad muscle tone, hey, muscles in the mouth, muscles of the tongue moving. I mean, you know, I'm watching my own mouth now as I record this, and boy, it's a lot of movement of lips if I really want to articulate everything well. My tongue is bouncing around. So we take this for granted, right? But mitochondrial supplements, like our Mitomax, helped her son's dyspraxia, and writing's coming back. That's amazing. But his articulation is still slow and low tone. Anything I can add? Diane, I think the next thing is, if you haven't gone down brain chemical way, the serotonin or the attention on the double, I think that's our next step. Maybe folinic if you haven't done it yet. Let's look at neurotransmitters. But this is a great start. This is great. This stuff works, guys. And this is why I need you to share. I'm happy to give this info to you guys. I'm happy to help your kids. I love it. But there's too many kids around the world struggling, and parents who don't know that there are answers. And they're going to believe you because you have a true story. You have a real story. You helped your child inspire another family. They will never forget you, okay? Remember the person that helped guide you to something that can help your child, right? Send this stuff around, please. All right, Amanda, is colloidal silver safe for everyone, even with Down syndrome? Yes. Nima, hey doc, my daughter is on amoxicillin for strep. Can we continue taking your yeast mold bundle? Yes. Make sure you add a probiotic. We got to replace those probiotics killed by the antibiotic. And again, sometimes we need antibiotics. It's all right. They save lives, you know? I've had kids with gut bacterial infections take antibiotics and start talking. Swear. Okay? Kaima, how does Candida affect speech? Well, I don't know if it has a direct effect on speech, but I know it has a direct effect causing pain and causing inflammation. And guess what? I don't want to learn anything when I'm in pain. If I have a migraine, I hate migraines. I have a migraine, day's over. I count it as a day of my life lost. I can't think, I can't do, I don't want to. I'm in speech therapy. Just stop, right? So I think part of it that is definitive is that we just see this, the brain is consumed with other things and it doesn't want to learn. I don't want to learn to talk. I just want to be out of pain, okay? So that's my answer. I think there's an indirect versus a direct. If there is a direct, I just don't know what it is. All right, Kate, how much colloidal silver a day? Again, bottle instructions. Diane, Yella. I took Tylenol while I was pregnant. My son took Tylenol after every vaccine, as do most kids around the world. I know. He regressed. He's level 1 autism, non-conversational. His behavior's fine. I fixed his diet, but his speech hasn't improved. Now I'm following a protocol to detox. Can I add the flinic acid to it? Definitely. He's taking a multi-omegas, another brand's couple supplements, and a multi-mineral from us. Definitely add the flinic. Definitely add our serotonin, Daniela. Start with those two for language. And we'll have a language podcast next week. Annie, how long we should give colloidal silver? Again, bottle instructions, at least 3 months, guys. This takes forever. Yeah, people are saying how long, at least 3 months, and then recheck. Is it also good to give Senna tea for constipation? That is great. Rob Fontaine's watching. My buddy Rob from Rhode Island. Hope his 3 kids are doing well. Rob's got his hands full. Exeber, hey doc, for hand flapping and hand kicking. Again, look at gut infections, but also try our attention on the double supplement and our temper tamer supplement. I find attention on the double and temper tamer can help with a lot of stimming, like the hand flapping, but don't forget gut infections. Consuela, I'm glad you asked this question. Where can I get these in the United Kingdom? We have a solo distributor of all Spectrum Awakening products in Europe called Mandy Mart. M-A-N-D-I-M-A-R-T. Okay? Mandy Mart imports supplements for kids with autism. They're a family who have a child on the spectrum, and they did this for him, and now they do it for people in Europe. So it's mandymart.co.uk in the United Kingdom and mandymart.eu in the rest of the European Union. The split because of Brexit. All right. Danny, what can I give my son instead of acetaminophen? Ibuprofen, homeopathic belladonna, curcumin, omegas. Cynthia, I've read that you should try avoiding sugars and carbs while trying to treat gut issues. Cynthia, I'm glad you brought this up. Yeah. It was a great wish. I'm trying to figure out how I can answer this shortly and succinctly. It's a great research study I saw from a gastroenterologist who I adore, Tim Bowie. Tim Bowie is in the Boston area. He's, I think, the best autism gastroenterologist out there, an amazing guy. And he published a great study showing that, and he did colonoscopies and checked the microbiome, checked our probiotics. When you eat sugar, bad bugs grow, okay? These bugs in our gut, all of them, the good, the bad, they eat what we feed them, right? And if they like the food, they'll stay. And if they don't like the food, they'll leave, okay? I'm no particular fan of lamb. So if I go to a restaurant, it's like, well, we only have lamb. I'm going to another restaurant, right? So the organisms in our gut will live there if they're getting the food they want. And if not, they'll detach and go somewhere else, right? They know the exit door. It's brown. Bye-bye, okay? So when you eat sugar, the bugs that stay there are the bugs that cause problems and inflammation. When you eat fiber, okay? Fiber, the good bugs stay, the bad bugs go, all right? So it's this balance of fiber and sugar that controls the bugs that live in our gut, right? If you stop the sugar, those bugs will go away. But it sure takes a long time, and it sure is hard to do, especially for our kids. So will it work? Yeah, but it's a gosh darn long, hard road to do. So what I tell my parents is reduce unnatural sugars as much as possible. Stick with fruit, okay? Stick with honey, Stick with syrup, right? Just reduce, cane sugar and glucose and that kind of stuff. Let's get rid of the obvious unnatural sugars because we need balance. You need balance, and more fiber is going to be better than pulling back on the sugar. All right. Toshiba, can you put comments the meds so I can get them for both my kids? Yes, we'll email that out. Consuela, can you tell all vitamins autistic child should use? Well, Consuela, we just launched our brand new multivitamin called Multispectrum Complete. And that is a comprehensive multivitamin with the vitamins, the minerals, and the cofactors in the forms that our kids need at the doses they need. So we just launched that in October. I would do that. All right, guys, we're already over an hour. I'm not done with the questions. Let me just kind of read a couple extra. Casey, as a provider, I struggle with parasite detox in pediatric patients. What do you recommend? Hoping you offer a tincture. I don't have a tincture, Cassie, but there's a lot of great anti-parasitic, stuff out there, for the natural and the herbal. So I would, if you find something that your patient will take and likes the taste of, that's the biggest hurdle. And we'll often do these pulse doses during full moons, unless they're new moon kind of kids. And it's a lot. It's a lot to get rid of them. But I also like the pharmaceuticals. My patients, I say, hey, let's do some artemisia, let's do some other tinctures. But if you can get metronidazole, if you can get a bendazole, do it. Okay, it's tough to get rid of. I won't even get into ayahuasca as an anti-parasitic protocol. Stella, can I use Power and Focus, Flinic acid together? Yes. All right, Capri, what can I give my 14-month-old son who's constipated? Make sure you watch last week's podcast. Brown Log Train is our best supplement for constipation. Go back, watch that. All right, Kaima, when will the Skowron solution be back in stock? Let me look at our website. I think it is in stock. Let me make sure our website shows that. All right. Last question, Junior. I'm a mom, a 3-year-old in South Africa. You talked about Power and Focus. And the South African supplier doesn't have it. So Junior, you got 2 options. You got 3 options. Email that distributor and say, I want Power and Focus from Spectrum Awakening. Okay? Maybe he'll order it. Number 2, you can have it shipped from the US. There are DHL shipping fees. There are customs fees when it arrives in your place. I don't even want to think about what's going on with tariffs here in the US. Another option is to order from our European distributor, Mandy Mart. They may have more affordable shipping or something down to you. But those are your options. All right. So many great questions, guys, but I kind of got to wrap up now just because of time. So behaviors in our kids, they're a big problem. All right. And especially when people are getting hurt, when they're hurting themselves, they're hurting others. It's a big problem. So you've got to help your child feel better, and you've got to figure out why they're upset. All right. Are they sad? Are they scared of something that's going to happen? Or are they in pain, right? If they're hurting themselves or you, they're in pain, okay? Find the pain. Teething pain, growing pains, gut infection pain. Number 1 cause of behaviors in our kids, even the hyperactivity, gut infections. So what do? You bind it and you kill it. So you take things like our gut binder sweet tasting, our yeast mold bundle, colloidal silver. It's all got great scientific research behind it. If you really want to find that bug and go after it, get a stool test. Okay, you want a really good stool test? We've got them on our website. Ask your doc. That'll really figure it out. Okay, but trust me, if you're dealing with behaviors with your kids, and if you haven't treated a gut infection yet, try it. Try it. You'll know within a month if it's going to work. Okay, it takes longer than that to get rid of it all, but you'll see the benefits. Okay, so good luck. This gut infection, the behaviors is a big nut for a lot of our kids, for a lot of you guys. But trust me. When your kid's happier and calmer, the whole house is going to feel better. We all know this, right? So I don't want you walking on eggshells. I want you active and proactive to help your kids. All right. One more time, the coupon of the weekend, everybody, is backwards, Candida 20. Candida 20 gets you 20% off any of your supplements, any of your lab tests, including the stool test and all the yeast mold stuff, everything there. Expires February 16th, 2025. And good luck, everybody. I love that you're doing everything to help your kids. Next week, we're going to be talking about language and neurotransmitters, how you can test those, how you can help those with your kids. But in the meantime, good luck. Have a great weekend and happy Valentine's Day tomorrow. And we'll talk to you soon. Bye-bye.